All right, this presentation is going to be looking over glenoid labrum tears. The labrum itself is found in the glenoid cavity and is made of a fibrous tissue. To deepen the socket of the shoulder to stabilize the joint. It is also a main point of attachment for many ligaments and also the biceps tendon. The tear itself, the mechanisms of injuries we see a lot are falling on outstretched arms, hyperextension, direct trauma, dislocation slash subluxation, and a repetitive throwing motion or any other type of shoulder heavy sport. But the most two common things we see is like the superior compression of the shoulder, like you would see on like falling of a outstretched arm, where that humeral head is jamming into the cavity. Or we see a traction injury inferiorly. These would be the two most common mechanisms. There's a few different types of ways we can categorize the tears. A lot of it is like kind of location wise, so it could be like posterior, anterior, superior, inferior, and then you can kind of combine the two to where it's like a postero anterior or postero superior and antero inferior, stuff like that. And then there's two other special types. One's called a slap tear and a Bankart tear. A Bankart tear is something we really see in a lot of anterior dislocations and subluxations, and it causes a lot of fraying and tearing anteriorly, as you can see in this picture. So it's not really in like that outside, but like from where that humeral head is like really scraping when it is popped out of place, it kind of frays and tears right there in part of the leg. And then a slap tear stands for superior labrum anterior and posterior. So basically, it's the superior part of the labrum and is torn all the way through, like from the anterior to the posterior side, and a lot of times will involve like the attachment of the biceps tendon or the biceps tendon itself. As you'll see in the next slide, there's a bunch of different types of slap tears. So to get into that, there's 4 different types. Type 1 is we're going to show fraying of the biceps insertion, but no detachment with a superior labrum tear anterior and posterior. Type 2 is then we see a detachment of the labrum and the biceps from the glenoid rim itself. So you're seeing it being kind of pulled apart and off of the bone. Type 3 is a lot like the picture we saw previously in this slide. So it's called a bucket handle tear. So you can see kind of how it has like that rounded handle shape. So that's why we call it a bucket handle tear. And then type 4 is also the same as it's a bucket handle tear, but also we're tearing the biceps tendon with it. Few different tests. There are none of them hold a lot of clinical value, but there are a few tests that have been proven to maybe show us that a labrum may be torn. One is the O'Brien test. I will put the links below. You watch them later. This one is also called the active compression test. But what you're looking for here is when they go from position 1 to position 2, you want to see a lessening of the pain or no pain at all. And that's going to be a positive sign. The clunk or crank test, they are kind of both the same. You want to make sure that you're in that 160-degree range. With the arm above the head, making sure to add kind of an anterior glide and a compressive force because we're really trying to get that humeral head into the socket. And then when you start moving it around in there trying to catch that tear, your positive signs are going to be grinding, clunking, clicking, kind of like the McMurray's click. And then the grind test. There's no video I could find for this one, but it is pretty self-explanatory. You want to put the elbow and the shoulder at a 90-90. And you want to add that compressive force again where you're really pushing that humeral head into the socket again. And you're internally, externally rotating, just trying to catch that tear again. So you're here trying to find that grind, the clunking, the clicking, whatever you want to call that. And then my PCOT analysis that I did was a study over 4 patients, all with different types of labrum tears. 10 were anterior superior, 20 were anterior inferior, and 10 were posterior inferior. They were all also athletes that were in a sport that used like a heavy shoulder motion. All 40 of them received this new arthroscopic labral debridement surgery as a way to maybe relieve the symptoms. So what they did is they were kind of comparing the different rates of recovery and the easy how much the symptoms eased for the different patients. A lot of times, mainly looking at 2 years afterwards, but also kind of what they thought 1 year after. So the outcome of this was every patient was evaluated at a minimum of 2 years post-operative. Only 7% of them saw relief in symptoms after 2 years. After 1 year, 72% of them were actually seeing the improvement, but it had later deterioration. Basically, they came to the conclusion that the arthroscopic labral debridement was not effective for long-term care of these tears. So then the time was a minimum of 2 years with a average of 43 months. These are my citations and where I got everything from. Thank you for listening.